big news for millions of Americans who take the popular weight loss drugs. The makers of those drugs are rolling out major price cuts after reaching a deal with President Trump. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News and joins us to sort it all out. Because when I first heard it this morning on the news, I said, this is great because so many people are taking these drugs. But you say, wait, not so fast. So how does it work? Who's included? When does it start?
So this announcement was for Medicare and Medicaid. So
patients only.
Patients only to start. There's a separate Trump RX plan, which we'll talk to in a minute. Mm-hmm. But the reduced prices, so Novo and Lilly, the companies that make drugs like Ozempic, Wegovy, Mounjaro, and Zepbound, they have negotiated a reduced price for the government of $245 a month. Medicare patients would be paying a copay of $50 a month. And for Medicaid, that's going to depend on whether states decide to opt in to do it, and then they set the copays.
But those savings are huge.
They are, but it's not for everybody who wants them. So just because you have, a high body mass index, you're obese, you're overweight, does not mean you're going to have access. So before it was restricted, for example, to people who were obese and had cardiovascular disease, or obese and had obesity. Now it'll expand a little bit to say obesity and high blood pressure, or obesity and prediabetes. So it's expanding a little bit, but not to everybody who's going to want these drugs.
So how soon will people begin seeing these lower drug prices?
So the Medicare access will begin middle of next year. Medicaid really just depends on what the states want to do. So that timeline is TBD. Then you have a second announcement that was made regarding Trump RX, which is a cash pay direct-to-consumer website that's going to be starting early next year.
What does that mean? How does that work? It starts January 2020. What does that mean?
So you still would need the prescription from the doctor, but you pay cash. It does not go through your insurance. The possibility is that commercial insurance plans may allow you to count that out-of-pocket cost towards your deductible, but they're not going to be involved in covering those costs.
So if you pay cash directly, is it cheaper? Is that how Trump
Well, there would be, so there's a discount there. So there you would see the drugs start at $350 a month, which is, compared to $499, $500 a month, is still a discount, right? Yep. And then within 2 years, down to the same government price of $245.
Is Trump RX a nickname, or that's what it's called?
That is what it's called. So Obamacare was a nickname.
Okay.
That was the Affordable Care Act.
Yes.
Trump RX is the actual brand.
That is the name. Okay, Dr. Gounder, thank you very much.